Hi, I'm Dr. Chiamaka from Doctalk, and today I'll be talking to you about malaria. The symptoms of malaria are largely not very specific and can mimic other conditions. Usually this will range from feeling a headache, a rise in the body temperature, so you notice that your body is hot. You might notice that you're shivering. Another important thing to pay attention to is that sometimes these symptoms are not constant throughout the day. So you might notice that you experience the symptoms in the morning and you feel better during the day, and later in the evening you start feeling hot or feverish again. Other symptoms include joint pain, muscle pain, vomiting, and even diarrhea. Some age groups such as newborns, babies, elderly people, pregnant women could be at the risk of malaria and even more severe forms of malaria. However, if malaria is left untreated in any age group, it could result in more severe forms and complications of malaria. Some of these complications include a low red blood cell count, or what we call anemia. Malaria could also result in liver failure, kidney failure, or cerebral malaria, which can result in a coma and eventually could result in death. Thankfully, the malaria vaccine has recently been introduced, and while that is becoming more popular and being embraced worldwide, there are other ways to prevent malaria. First would be to prevent mosquitoes. You want to ensure that there's no stagnant water around your house and that you clear thick bushes also around the house. Avoid water collections, water puddles, ensure your gutters are clear and clean. Secondly, you want to ensure that you have nets in the house that help to prevent mosquitoes from getting in, and ensure that you sleep under insecticide-treated mosquito nets. If your children have to play outside closer to evening, ensure they are properly covered, sleeves and pants. You also want to make sure that if you're pregnant, very importantly, that you attend your antenatal clinic. Your doctor would place you on certain medications that will help prevent malaria. So as we have discussed, malaria is very treatable, and when diagnosed on time, we can prevent lots of complications. You want to make sure that you see a doctor immediately who will probably diagnose you and start you on appropriate treatment. This could be oral medication, and in some cases, you will be given intravenous medication. Self-medication is never the right thing to do. The symptoms of malaria mimic symptoms of several other conditions, so you want to ensure that you're properly diagnosed and then an expert can decide the best treatment plan for you.